Hi sharks, welcome back. Today is a Shark Bites episode and I'm going to address something that is non-art related. So if you are not interested in this, because it is not art related, you might want to bow out now. But I've had people asking me about my chronic illnesses and what has caused my disability. So I'm going to explain it here today. I have a rheumatic type or immunosuppressive type of disease. It is called Ankylosing spondylitis, and I will put the name up here so you can see it. It's called Ankylosing spondylitis, and spondylitis also carries a few different terms. There's spondyloarthritis, spondyloarthropathy, and spondylitis, which are used interchangeably. Ankylosing spondylitis means that you've had fusion somewhere in your body. It works differently than like rheumatoid arthritis, which is an arthritis that attacks the joints. You'll see people with enlarged joints and stuff like that. That disease attacks right within the joint. Spondyloarthritis attacks the ligaments and tendons that attach themselves to the joint and inflames them. And with chronic inflammation and pain, it begins to fuse them into bone and eventually will fuse the joint completely into one bone. The joint basically is rendered useless at that point. Spondylo means spine. So the majority of this disease you will see in the spine, usually starting in the lower back and pelvis area, particularly the SI joints or sacroiliac joints that lie on either side of the spine down in the lumbar area. It causes extreme pain, and I get a lot of hip pain and low back pain. It can also attack the cervical spine. It's more rare to begin there. Usually as it progresses it will come there, but there's really no rhyme or reason to the disease. Even though the majority of people will have it begin in their SI joints, I have fusion in my shoulder. It's called, where the clavicle meets the shoulder joint, it's called the acromioclavicular joint. That is completely fused. I know this one is. This I have a lot of pain in too, so I'm thinking this one might be fusing also. But I don't have fusion in my low spine yet. So that's the case there. I do get something called enthesitis, where the tendons and ligaments will inflame, and they if left untreated, will cause fusion. And I've had that in my hip, but I went through physical therapy recently and that improved it. The only way to slow down the progression of disease is with biologic medications such as Enbrel, Humira. You might see commercials on TV for those. And so I take an injection every week that I give myself. And hopefully it'll stop the progression of the disease. Unfortunately, it carries a lot of side effects with it. It can cause MS, it can cause lymphoma, and other blood cancers, leukemias and stuff like that. But I was in so much pain and had no quality of life, so I chose to take the injections. The other thing is exercise. Exercise has been proven to slow the progression of the disease. The problem for those of us with the disease is that when it gets to a certain point where our pain level is so high, like mine is, it becomes really hard to exercise. So I have to walk a fine line where my exercise doesn't go over so many steps, because if I get over that point, then I am up all night in agonizing pain and have to take pain medication just so that I can get some sleep. I don't sleep well. Nights are probably my worst time, and usually it'll begin around 7 p.m. and then I'm up all night, and I'll fall asleep at about 4 in the morning, and I get a few hours of sleep, and then I start my day again, and that's how it goes. Some will tell you that the symptoms that you have, many doctors who do not stay up to date on the latest research through the Spondylitis Association of America will tell you that you should fit these certain symptoms, that you wake up and you're more stiff in the morning and your pain improves throughout the day and these kinds of things. There is proven record now that people with ankylosing spondylitis have different types of pain responses. Some have more pain in the evening or throughout the night, which is very common for people with spondylitis to have pain through the night where they can't sleep. You're just writhing in pain, and you'll finally collapse to a sleep at like 4 in the morning. I have to get up and walk frequently through the night because the pain gets so bad. And for me, standing up temporarily will trigger that pain to go back down again. But the minute I try to sit or if I stand too long, more than a few minutes at a time, like I couldn't just stand still at a party for 15, 20 minutes in one spot. I can't do that. I can't sit for a period of time in one spot. I have to take breaks and get up and move around, or I have to lay down. Laying down for me helps considerably during the day. At night, though, when I'm trying to get 8 hours of sleep, I can't lay for that period of time. So I get up every 1 to 2 hours through the night and I have to walk, and then I lay back down. And that helps me a little bit. The problem is that I don't get good sleep at all. The one thing I wanted to tell you, though, is that I did see a video here on YouTube from a physician, a rheumatologist, who talks about the symptoms and how different they can be. So I'm going to try to remember to link that video down below for you if you want to watch it. It's very interesting, very short, only like 5 minutes. Not long-winded like I am. I'm sorry about that. But anyway, it pretty much crippled me. For me, it started in, I would say 2005 is when I really realized that something was not going right for me. Prior to that, when I was young, I did have back pain and back problems and would have difficulty walking home from school sometimes. And I remember in junior high, my mother having to drive me back and forth to school because I just couldn't walk it. My back hurt too bad. She took me to a doctor, and that doctor said it was growing pains. That's a very common thing that doctors will tell parents of young children that come in with chronic back pain. They say it's growing pains, or they used to in the old days. I was a 60s child, so 60s and 70s. So I got that diagnosis. I wonder often if that was the case back then. But then it kind of healed itself. By the time I was 18, it stopped, and I didn't have a problem again until 2005. Then I started having back pain again, and I started seeking out my diagnosis. And I began getting back injections. You can't get a diagnosis right away. They say that you have to have chronic back pain for 3 or more months, and then they start to do things like x-rays and stuff to see if they can see any fusion of the joint or inflammation of the SI joints. They don't normally check other areas like the shoulder and that kind of thing. So I had x-rays done, and I had some inflammation there, but they thought maybe it was from an injury. And so I started getting back injections, the corticosteroid injections done by anesthesiologists in their offices, and I went to a pain clinic to have it done. Also, I have asthma. I have a congenital heart defect that they think is related to the disease because it involves my aortic valve. I am beginning to get, I'm on the bubble for an aortic aneurysm because of the pressures that it's putting on my aorta, because my valve is leaking so bad. I have something called aortic insufficiency I get short of breath and winded very easily. Sometimes when I'm doing videos, you'll hear me being kind of winded, and they think that it's related to either my asthma or my heart defect. And I'm following up with my cardiologist on that. So, back to the spondylitis. I forgot where I was now. Hang on. I remember. So, I started to seek treatment out, and I was going through these injections. Well, I also take a corticosteroid inhaler for my asthma. And over time, I started to feel worse and worse and worse. And this is over a period of years that I was getting these injections. And I was getting dizzy spells, falling down the stairs, all sorts of things, falling down at work in front of patients. And it was unsafe. And my doctor finally said, we haven't checked a cortisol level on you, have we? And I said, no, we haven't. And so he said, let me check that. Sure enough, I had no cortisol. Cortisol is the stress hormone in the body. Without it, if we don't have stress hormone in our body to handle physical or emotional stress, it becomes fatal. You'll go into a coma, shock, and die. So I was having these symptoms, and they checked me, and I had no cortisol. So then I had to go through something called a cortisol stim test, where they try to stimulate the pituitary gland to release something called ACTH, which is a hormone. Adrenal corticotropic hormone is what it's called. I'm an RN, so that's why I know all this stuff. But and then it releases into the system, which triggers your body for stress, and then your body should release cortisol. Well, they put me through this test where they gave me fake ACTH, or they gave me ACTH and blasted my body with it, and nothing happened. I had zero cortisol. So at this point, they are assuming that it's a secondary adrenal insufficiency. The other name for primary insufficiency would be Addison's disease. You may have heard of people who have Addison's disease. That one's even more severe. So they don't know for sure which one I have, but the assumption is that I probably have secondary because of all the steroid use I had between my hormone or my steroid inhaler for my asthma and my steroids for my back injection. And then I'd be on steroids occasionally, like dose packs and that kind of thing, on top of everything else. Most people don't have a problem with steroids. I'm talking about everyday use for 20-something years, with my inhaler. So now I take steroids every day. My adrenal glands have then wreaked havoc on my other endocrine glands, like my pancreas. Now I'm pre-diabetic, and I take medication for that. I have low thyroid, and they say that if I had been treated with that thyroid problem prior to getting treated to the adrenal problem, it could have killed me. So I'm lucky that my doctors were on top of it. So it's kind of wreaked havoc on my endocrine glands. And I also have osteoporosis, which is basically where your bone breaks down. Your body should be developing new bone marrow, and your bone should stay nice and hard, but with osteoporosis it gets soft. That is also an effect of or complication of ankylosing spondylitis. Ankylosing spondylitis, though, causes bone formation on the spine. So diagnosing osteoporosis can become very difficult. Hang on. I'm sorry. My dog is barking at a little boy who's walking his two dogs down the street. So anyway, I was talking about osteoporosis. It can be a complication of ankylosing spondylitis, and it is very hard to diagnose it because ankylosing spondylitis causes new bone formation to grow and basically cause what we call bamboo spine. It looks like bamboo. You'll get a nice long bone, and then you'll get this lump of bone, long bone, lump of bone, where your vertebrae should have been, and now they're not. So anyway, when that happens, bone density tests have difficulty diagnosing osteoporosis. Luckily, mine was diagnosed, so I take a monthly medication, although it's causing complications, and my doctor wants me to go to a yearly IV medication. So I'm not sure what we're going to do there. But there are so many different medications for ankylosing spondylitis. Some people are on Remicade infusions. Some people take a newer drug called Concentrix. Some people take another drug called Humira. I just happen to be on Avonex. And some people choose not to take anything at all. To me, that's too risky. So, because they're afraid of the side effects. They say that these side effects, like the lymphomas, the cancers that you can get from these drugs, is more common. It's not common, but it's more prevalent in people who have rheumatoid arthritis and take these drugs for whatever reason. Now, I'm wondering if it's just because they've done studies with rheumatoid arthritis. Ankylosing spondylitis is very underfunded, and we need a lot of help with it. So, at the end of the video, I'm going to put down a website if you are willing to donate anything at all to that website or to that research company. It's called the Spondylitis Association of America. There's also one in Europe if you're European and you'd rather support your own country. The NASS, National Association for Spondylitis, or something like that. NASS is what it is. I think it's nass.org. And that one is in the UK. But in America, we have the Spondylitis Association of America. And I am a member there, and I give charitable donations to them throughout the year. So it's helpful. And if you do have spondylitis, spondyloarthritis, axial spondylitis, or spondyloarthropathies, or whatever the case may be, for just $35 a year, you can become a member, gain access to all of their educational information, and also receive a quarterly magazine, which is excellent. It's called Spondylitis Plus. When you become a member, you can go back and read online their old issues, so which is also nice. I recommend it for anybody who has that, or if you have a family member with it. It's really helpful. But that's all I wanted to say about osteoporosis. That was another one of my complications, my many complications. So they think my migraines, my asthma, and my aortic insufficiency is all in relation genetically to my spondylitis. So anyway, I hope that explains things a little bit better. I'm going to move on to the rest of the video here. So with my ankylosing spondylitis, my pain was getting out of control, and I started taking pain medication. Now I take pain patches, fentanyl patches that I wear. I'm not suggesting anybody else seek this treatment out. I'm just saying what I have been dealing with. And then I'd have to take breakthrough pain medication when my pain gets real bad. I can only sit for short periods of time, then I have to lay down. I can walk, then I have to lay down. I lay down several times a day. Sometimes I have to nap because of the lack of sleep that I've had. And then the pain. And then in the evening it really ramps up and gets difficult. That's part of the reason you haven't seen me post many videos lately. I've been having a really tough time recently between the shortness of breath and the pain that I have. Most people, like I said, just have back pain, or many have back pain, but they're finding now that more and more people are having peripheral joint pain in our other joints in our body. So I have pain in my shoulders, I have pain in my hands. I have pain really bad in my feet and my hips. And then, of course, I get nerve pain from the back. It has caused like numbness and tingling and pain in my legs and my arms. I did have 4 fusions done on my neck. There's a scar somewhere here. I don't know where it is. I think it's on this side, but you can see it right in the crink of my neck here. Anyway, I had 4 fusions done to my cervical spine. I had a compressed spinal cord, and it had gone months undiagnosed. I went to one surgeon who said there was nothing wrong with me, and then when I went back to my regular doctor, she said, hang on one second. She went out of the room and came back, and she said, I want you to see this orthopedic surgeon, and she gave me his name, and she said, I made an appointment for you. He wants to see you right now. And I thought, oh my goodness, what's wrong with me? Well, I get there, and he said, your spinal cord is so compressed. Have you had any problem with falls or loss of use of your legs or your arms? And I said, well, yeah, I have. That's why I went to the doctor to begin with, and they were checking my neck out. I was having some neck pain. And he said, well, your spinal cord is flat. And he showed me on an MRI. It was flattened like a pancake, and it should be round like this. So I had those fusions done. In having that done, it was an urgent surgery. He told me to go home, don't sneeze, don't cough, don't get in a car, don't do anything because it can cause paralysis. And I did not want to be a quadriplegic, so I did what he said. They couldn't get me off of my pain medication in time before surgery. When you're on pain medication chronically, it causes your opioid receptors in the brain to trigger a need for more opiate in order to control that pain level. So after my surgery, being that I was taking the patches and I was on pain medication, actually I was on a higher dose patch at the time, and the breakthrough pain medication, I was taking it as directed, but I felt it was too much. They put me on a pain pump afterward. I had my patch. I had a different pain pill, muscle relaxer, and Valium, and they were giving them all to me. And I ended up going into a respiratory arrest in my room, and I kept telling the nurse, I'm not breathing. I keep stopping. I'm not breathing. Please, somebody has to sit with me. She got mad at me. She was a horrible nurse. And she came back in and she said, your doctor said that you were scheduled for a sleep study and you didn't go. And I said, no, that's not true. Actually, it was my husband who had been scheduled for a sleep study, and they had mixed it up. And so the nurse thought I was lying to her. She said, are you saying your doctor is lying? I said, no, I'm saying my doctor's mistaken. I need somebody to stay with me, please. And by that time I was crying. Well, I ended up going into a respiratory rest, and I woke up with the CPR team over me, working on me. And as a nurse, I knew that it was bad, and it freaked me out. They were putting me on heart monitors, putting IVs in my arms, doing all sorts of stuff. The crash cart was in the room, and I thought, oh my God, I'm dying, And I started to have a panic attack. I'd never had a panic attack before. Well, I had been going to the pain psychologist at my pain clinic, which is what they recommend because people with chronic pain end up with depression, which I do have. And I started to talk to him about my problems, and I couldn't walk back into a hospital. I was having such difficulty. Just driving by it gave me panic attacks, and I couldn't get my anxiety under control. And he diagnosed me with PTSD. So I'm dealing with that as well. As a nurse, that would make it very difficult to return to work on its own, but that's not my primary reason. My reason is because of the pain, and so that's why I'm not working at this point. I don't know that I can ever return to work because my disease has been progressively worsening over time, which is the case with most people. So anyway, that's basically it about my disease. I am something called HLA-B27 positive, which means that I have a marker. Some people call it a gene. It is not a gene. It's a genetic marker of some sort, a protein that's on the white blood cells that is not normal, but many people have it. HLA-B27, you can be positive and have no disease at all. But people with certain autoimmune diseases tend to be HLA-B27 positive. So I am that as well. And they believe that that's what's triggered a lot of my other issues, my aortic insufficiency, my asthma, my migraines. The migraines are horrible, and that is also related, they say, to ankylosing spondylitis. They find that many people with that disease also have migraines. My migraines have been uncontrolled for years, and doctors have tried to control it. I do take a breakthrough pain medication that works wonderfully, but I can only use it 3 times a week. If I get to that 3rd day, it causes rebound headaches, and then I start getting them daily. I can't keep taking the medication because it will stop working, and the headaches get progressively worse. Yesterday, I had a horrible migraine, and I had to go visit my father and then go with my husband to his doctor's appointment. And I was just vomiting and vomiting and vomiting in the toilet, and I thought, how am I going to get there? Finally, I just got sick. There was nothing left. Sorry for the graphic thing. And I got in my car and I went to see my father, and eventually my headache let up because I had taken my medication. So I average anywhere between 12 to 24 headaches, migraine headaches a month, depending on how well I can control them. I've been to 4 doctors for that. I've been to the Head Pain Institute in Ann Arbor at University of Michigan, and they helped me a bit, but everyone has tried all the prophylactic medication, meaning medication that you take daily to prevent migraines, and none of them work. So they all throw their hands up and want to send me to another doctor. Going to another doctor isn't going to change anything, so I've just been trying to handle them on my own. I don't go to the emergency room because I'm already taking everything that they can give me. So I'll close myself up in a dark room, and I might stay there for 2 days at a time with ice packs on my head and earplugs in, or I usually will put my headphones in my ears, which work like earplugs, and I just sit there still. Sometimes sleeping helps me get through them, and I can sleep anywhere from 12 to 17 hours when I have a headache, on and off. I'll wake up from the pain, but that's about it. So that is what I deal with in a nutshell. The spondylitis is a very painful disease. Many people have written to me after I've said something about ankylosing spondylitis before, and they say, I wonder if I have it because I have back pain. Most people's back pain is either muscular or disc related, like degenerative disc disease. And I'm not minimizing that. It can be very painful also. Mine, it works very differently. And the type of pain that I have, like right now, I need to get out of this chair, is very different. And it's so debilitating that it takes over your life. So I try to stay positive, put a smile on. I get up every day, I shower, I force myself to get dressed. Some days I put on makeup, especially if I'm going to be in front of a camera. I did not do my hair today. But I do those things in order to try to keep my sense of a quality of life going. I try to do some sort of activity every day. Some days I'm lacking, some days I do better. But that's basically it. Some days are very difficult to walk on my feet. If I have to take my migraine medication, it affects my joints horribly. And it makes it very difficult for me to walk. And I walk very stiff like this, just very stiff. And rigid. My ankles won't bend and my feet won't bend. And it's very hard to walk. I use a cane sometimes. I use a walker sometimes in my home usually. I don't usually go out with that. And I think that's pretty much it. So if you do have ankylosing spondylitis or spondyloarthropathy or spondyloarthritis or axial arthritis, any one of those terms that they've given you, it all pretty much causes the same pain. Fusion doesn't necessarily relieve pain. That's been a big misnomer. They say once you're fused, the pain goes away because you no longer get inflammation there. But you do. You still get inflammation. And inflammation causes pain. My C-reactive protein runs high, and occasionally my SED rate runs high. Those are often used in diagnosing rheumatoid arthritis. We run along the same gene lines. There are different forms of arthritis that can cause ankylosing spondylitis. Reactive arthritis, which is usually due to leaky gut syndrome or infection. There's psoriatic arthritis that can lead into ankylosing spondylitis, rheumatoid arthritis, and then spondyloarthritis. Those are the different types of arthritis that lead into ankylosing spondylitis. They don't necessarily go that far, but they can. And I hope that those of you watching don't have it, but if you do, I'd be willing to talk to you about it. Try to stay positive. This is not a fatal disease, although it is debilitating, so you have to try to stay active. The younger you are, stay active so that you can prevent this from just inflaming your entire life. When I was younger, I was pretty active, and it has kind of consumed me now. So trying to get activity in. I wear a special watch that counts my steps, and it tells me how many steps I've taken. I set it for 6,000 steps a day, which is pretty difficult for me to get to. Most people can get to 10,000, 12,000 without any difficulty. If I ever get up that high, and I have on occasion by pushing myself really hard, I'm in agony, and it takes me 2 to 3 days to recover from it. So I have to walk that fine line of exercise where I never go over. I can't get to an aerobic level that forces me to overwork my joints, because when I do that, then I'm down for a couple days. It kind of works negatively, and it makes you think like, no, I can't exercise because I'm going to hurt so bad afterward. And it's not that good hurt that you get when you do too many sit-ups or you do too many leg lifts and you go, oh my God, my muscles are so sore the next day. And if somebody smacked you in your muscle, you just hit the roof. That's good pain. This pain is all bone related. Some of it can be muscular, but mostly bone related, nerve related, and it is horrible. And it knocks you on your back. So one other thing that I have been diagnosed with, and I've had it, of course, all my life. You might have heard people who say they're double jointed or whatever, and they can bend their thumb down to touch their wrist, and they can put their legs up behind their head. I was one of those people. Ultra flexible. In fact, when I go into the doctor now and they try to check my legs and my hips, they say, well, you have good flexion and good motion there. It's because I have something called hypermobile joint syndrome. They're not sure if it's Ehlers-Danlos syndrome or not. That would have to be diagnosed, and I really haven't sought that out, although I probably should, because a lot of the symptoms overlap, and that's another genetic disorder. And I believe it's also autoimmune, but it's called Ehlers-Danlos, and the first symptom is usually hypermobility of your joints. And I used to put my legs up behind my head. I used to do back bends, and I could get my head to touch my feet again on the other side. I was so flexible. I'd go into a circle, I did gymnastics as a kid for a short time, but anyway, yeah, so that's another problem I have. And they say that hypermobility of the joints leads to arthritis later in life. So I do have arthritis in all of my joints, but I'm not sure if it's Ehlers-Danlos or not. I really should get it diagnosed. And when I go to see my doctor, I'm going to talk to her about it, because every time I go to the doctor and they say, well, you've got good mobility in your joints, and I tell them I have hypermobility, they say, oh, do you have Ehlers-Danlos? And I'm like, well, I really don't know. So they say, okay, and they leave it at that. So I should get it diagnosed. But because there are treatments and there are other symptoms that go along with it, like eating. I have a lot of trouble eating, and that seems to be a problem. But I don't know if it's pain related or not. Like right now, it's almost 3:30 in the afternoon, and I haven't eaten today, which is really bad because I need to eat. But when I eat in the morning, then I get sick. So I don't know. Anyway, that's my tale of woe. This is what I deal with. And it's my life. In the beginning, I went through the grieving process. And I think anybody who's new to this disease, if you sought out a video on ankylosing spondylitis on YouTube and mine popped up, just know that it's normal to grieve. I was very angry in the beginning. I was so active. I was an avid hiker. I golfed. I was on golf leagues. I loved to bike. I did the 60-mile breast cancer walk and trained for 6 months for that back in 2002. It was 2003 when things started to change, and I noticed it. I ice skated, figure skating, and I did all sorts of stuff. I was just active all the time, always out and about. I love being out in nature. So hiking was such an awesome thing for me. Just some water skiing, all of it. I did it all, and I loved it all. I loved, different sports and getting out and being a part of them. And now I've given it all up. I can't do any of it. I can't ice skate. I can't. If I fall, I'm going to break a bone. I can't bike very far. I can't walk very far. I can't hike. There's just so many things that I can't do. And it still bothers me a little bit, but you adjust over time. And for me, art became my outlet, which is why I paint now. It's something that is less painful for me to do. I can do it in short bursts, and I can come back to it to finish, and take breaks when I need to take breaks. So painting, and it helped me to release the stuff in my head, Art does that for you. So that is the thing that I love to do now. I used to knit a lot. I don't do that as much anymore because of my hands. It hurts. But on occasion I will knit something little. Sitting in front of the TV when I'm in pain. I do mindfulness training. So that's what I recommend you do, is mindfulness training. Look it up online. It's very easy, but it's very easy to perform, but it's hard to master. It probably took me 2 years to really get it down to where I can control my anxiety a little bit better. I can control panic attacks better now. I use distraction as well with, the painting and stuff. Although my painting sucks on days when I'm hurting really bad. But anyway, do those things because you are going to grieve. You are going to be angry that this is changing your life. And it's going to be there forever, unfortunately. It doesn't undo. All you can do is try to use every treatment advantage to your best ability and stay active. Stay as active as you possibly can, because the minute you stop, it starts to change. Nobody told me that in the beginning, and I went 9 years before I was diagnosed, so I kept lowering my activity level, and it was making it worse. And now trying to get it back, it's not happening, unfortunately, for me. So stay active if you can. Don't push too hard. You don't want to cross the line where you're in agony for days and you can't get out to do anything at all. But just, do what you can. And if you need somebody to talk to, you can talk to me. There's also lots of Facebook groups for spondylitis online on Facebook. So if you're on Facebook, you can talk to people there. Just don't get caught up in everybody's diagnoses, because they tend to think that they know it all and want to diagnose you. And don't get caught up in that, because everyone's different. And you need to speak to your doctors about it. You need a good rheumatologist. So find a rheumatologist. Don't just use your family doctor. It's a very specialized autoimmune disease, and you need a specialist to treat it. Luckily, my doctor sent me right away to a rheumatologist. So anyway, I think that's it now. And I'm not necessarily going to make this an ankylosing spondylitis channel, but occasionally I will talk about it and vlog about it, so that anybody who has it, who wants to commiserate or communicate or just ask questions, can contact me. So have a great day, everybody. And the one thing I wanted to say also, it took me 9 years, I believe, to get a diagnosis. 6, 7, 8, 9, 10, 11. Yeah, it was 9 years. It was 2003, I think, when things started. And I think I started injections in 2005. So it started then, but it would get better, and I could become active, and then it would go away. But now it's just not going away. So it took me 9 years to get a diagnosis. I went to, I think, 11 doctors. I was misdiagnosed with MS and took medication for MS for about a year. I'd go in for massive steroid treatments, IV. They thought they saw lesions in my brain and in my cervical spine. The lesions in my brain turned out to be scar tissue from my bad migraines. They leave lesions in the brain, and that's not good. But migraines can be pretty serious. But I was misdiagnosed with MS, and for a year I thought I had MS, and I was taking something called Avonex, which is an interferon injection that I took weekly, and it made me so horribly sick. I'd take it on Friday right after work, and I'd be sick all weekend, and then I'd go back to work on Monday, and it was so hard. I just kept getting worse. My pain was getting worse, and they said, you shouldn't be having this much pain with MS. MS isn't supposed to be painful like this. And I said, okay, well then what is it? I keep getting plantar fasciitis. That's another problem that you get with ankylosing spondylitis. I have it in my left heel right now. At one point back when I was working, I was in one of those big boots for fractures for 4 months before it healed up. But even now, my heel is still not right. It comes and goes. So that's another thing that causes problems. There are a lot of different, weird little different things that go along with ankylosing spondylitis that you'll get along the way. And plantar fasciitis is one of them. Repetitive and hard to heal. Everybody can get plantar fasciitis. You can get Achilles tendon issues. I've had that too, where my Achilles tendon feels like it's going to snap when I'm walking. So then I walk very stiff and I don't bend my feet because it hurts. But anyway, that's pretty much it. So leave a comment down below if you have it, if you don't have it, if you want to know more about it, if you just want to talk. I didn't do this video for sympathy, so please don't think that that's what I'm trying to do. I'm just explaining this disease to you. So everybody have a terrific day, and remember, be courageous, paint with wild abandon, and most of all,